my name is Scott. I'm a physical therapist assistant here at North Point Orthopedics, and today we're going to talk about some patellofemoral pain that is in the knee. And today with me, I have my patient, Hannah. She is also a physical therapist tech with us, and she'll be a patient today. All right? So the patellofemoral pain, your patella is your kneecap, and the femur is this bone right up in here. And it's also comprised of your tibia, which is another bone down here. So that's the whole knee joint. And patellofemoral pain is a pretty generalized term. A lot of it tends to have to do with muscle imbalances going on in the knee, not just the knee, but as the hip as well. So today we're going to be addressing some of those issues. So first, a good way to address it is to stretch out the hamstrings. Most people do have tight hamstrings. So all we do is put the strap, bed sheet, dog leash, belt, whatever you can use, and you want to pull up till you get a nice comfortable stretch back here. You want to hold this stretch 10-second holds 10 times. So the next exercise is called a straight leg raise. So what this requires of her is to raise her leg straight up. So to instruct her on this, first I ask her to push her knee down into the table. You could use your hand as a cue if you need, or a towel. And then what she's going to do is, while that's contracted, she has to raise her leg straight up about halfway, 45 degrees, and then come back down. So I'm not going to assist her on this. Make sure you push your knee down, lift straight up, and back down. Good. She's going to do this 10 times to start, and when it starts to get pretty easy, she would up it to 2 sets of 10. And this here is working the hip flexors in the front. So we want to work the hips because a lot of the muscles in the hip kind of stem down into the knee. So what we want to do is we want to work on controlling this muscle as well as strengthening this muscle in the front to work on the proper balances in the leg. Yeah. Exercise is called hip abduction. Abduction is where the leg goes straight out to the side. All right, so what I want to instruct her on doing is keeping this knee straight. You don't want a knee bent. You want to keep it straight, and you do not want it to drift in front of you when you lift, because that again will start working the hip flexors. We just worked those with the straight leg raises. So what I want her to do is I want her to feel it right on the side of her hip. So go ahead and lift. Good. And back down. So again, you're only going to get about 45 degrees of motion, if not less, because if she tries to lift higher, go ahead and try and lift higher. Go higher than that. What happens is we start to drift in front of us, or the body starts to roll backwards a little bit. So we want to avoid that. We only want to target this muscle. This is called the gluteus medius. This muscle helps keep our pelvis stable, and it actually works with the balance down the knee. Good. So the next exercise we'll be doing is called prone hip extension. Prone is laying flat on your stomach, if you can make it there. And the goal with this is to start strengthening the gluteus maximus, also known as our butt. So what you'll be doing is you want to lift this leg straight up. Beautiful. So see how her pelvis stays down? She's not, go ahead and lift too high now. She's not rotating just like that, because that's going to start working the back and the back extensors, and that could actually cause some back discomfort. So this, she'll also do another 1 set of 10. When it gets too easy, 2 sets of 10. So the next exercise is called a mini squat. It is just as it sounds. All she's going to do is squat, but not all the way down. So this is important because you want to make sure you're watching your form when you do these. Go ahead and do a bad squat. Yeah. So if you watch down here, when she does that, her knees are coming in. That's bad form. Good form is where the knee is going to be directly in line with your second toe, and the knee is not supposed to pass over your toes. So go ahead and make your knees pass over your toes. That's not what you want either. She's in good alignment, however, it's going all past her toes. That causes a lot of stress on the knee. So the proper way to squat is where you sit your butt back and those knees stay directly in line with your toes. This decreases the stress, and it's actually a perfect squat. So if she needed to get something off the floor, perfect. So at this, you would be doing 1 set of 10. If that gets easy, you do 2 sets of 10. And we have this handy dandy railing that we use. What I recommend at home is using a countertop, just because it's sturdy and it doesn't go if you need to pull it. And if you lose your balance, you're not going to fall. So if you're finding the mini squats to be a little too easy for you, you can progress yourself to stairs if you have them. So with stairs, what you'd want to do is same exact thing as the mini squats. That knee has to stay in line with your toes. You do not want it to buckle in or out or any such. So when you step, you want to come up and then back down. You could do that 10 times, and then when it gets easy, 2 sets of 10. So after you've done 1 set of 10 of the step ups, you'd work on stepping downstairs. So same concept, however, your knee is going to go past your toes because that's just how we go downstairs. So go ahead and try it. Any pain?
No.
Good. So this again is going to continue working the quadriceps in the front. And you're going to keep working on that form. The knee is not buckling in or anything. It's right in line with her toes. That's perfect. And of course, if you need, you could use handrails for support. So the next exercise we'll be doing is a stretch, and this is going to stretch out the front of the hip flexors. Reason being is because a lot of us are sitting a lot at our jobs or something like that for a long period of time, which causes these to tighten up, which actually affects down the chain in our knees. So to stretch that out, what I would have her do is she's going to put her foot on the second step of the leg that we do not want to stretch. So what she does, she wants to lean forward into that leg. She wants to keep her chest up and her hips forward. We're focusing on stretching the front of the left hip flexors right now. Do you feel a nice little pull? Mm-hmm. Perfect. Again, stretching should be comfortable. I want her to hold that 10 seconds. She's going to do it 10 times. So again, just a disclaimer, if you start to get pain with any of these exercises, back off. If you cannot find a pain-free range, then make sure you discontinue the exercise and come see us here at North Point Orthopedics. Thank you for stopping in, and I wish you the best and hope to see you soon. Thanks.